Well, hello and good afternoon to everybody who joined us today. It's the 7th episode of the PM Radio Westminster. Today's broadcast is taking a deeper look at an industry that has been the focal point of nearly all discussions since the outbreak of COVID-19. Over the past few weeks, global news has been focusing on the announcements made by big pharmaceutical companies on their achievement in developing a vaccine for the deadly virus. From a project management point of view, how would the development of such an urgent and highly in-demand product would be led, steered, and managed? What would be of the most and utter importance when making trade-off decisions among projects' priorities? How does the management of projects and programs in the pharmaceutical industry differ from other industries? We are delighted to have Matheus Cavicchioli, a project portfolio manager at Tilots Pharma in Switzerland, to answer our questions and shed some light on how projects work in pharma, and our audience is always welcome to share questions and thoughts via the chat box. Okay, but as usual, what we do, we start with some news. We try to bring you the latest in the world in general, on COVID-19, of course, and on project management. So let's start with some news. Okay, so we will start with something about the lockdown. How's everybody doing in the lockdown now that we have experience in it and we have some lessons learned from the one we had in March? But the lockdown in England will end next Wednesday, the 2nd of December. But most of England is expected to be placed in the two toughest tiers of coronavirus restrictions when the national lockdown ends next Wednesday. Most areas, including London, would be in Tier 2 with significant numbers in Tier 3, the highest level. Differences between the tiers include limits on where households can meet up, for instance. In the new Tier 1, the rule of 6 applies indoors and out. In Tier 2, the rule of 6 remains outdoors, but there is no household mixing indoors. Chancellor Rishi Sunak told BBC Breakfast the new tiers represent a tangible change compared to the last 4 weeks of lockdown in England. There are significant differences to that. More of our life can resume. More of our economic activity can resume, he said. The system will be regularly reviewed and an earliest tier level may change before Christmas. The first review is scheduled for the 16th of December. Less than 2 weeks after the lockdown is left. Decisions on tiers are based on public health recommendations informed by the following factors: case detection rate in all age groups and in particular the over 60s, how quickly case rates are rising or falling, positivity in the general population, pressure on the NHS including current and projected NHS capacity, local context and exceptional circumstances such as local but contained outbreak. An area could be moved up a tier if these indicators are not improving, and likewise down to a lower one if they improve. So it really depends on all of us being as responsible as possible to avoid a harsh tier level being imposed on us in our areas. On a celebratory note though, and even though it's lockdown, this has not stopped brilliant and great project managers all over the world from winning prizes for their significant achievement in the area of project management. The Project Management Institute PMI Awards announcement took place recently by recognizing the best of the best in project management. PMI Professional Awards honor project management excellence and recognize true leaders in the project management profession who are changing the world through projects and serving as examples of success for future generations. The Project Management Office, or PMO of the Year Award for 2020, went to DC Water, Washington, USA. The project manager of that project said, "We did not prepare for COVID, but we were well prepared for a situation like COVID." The other award, which is called PMI Project of the Year Award, went to the Trans-Anatolian Natural Gas Pipeline in Turkey. This project, sponsored and led by the TNAP Natural Gas Transmission Company, it's worth $6.9 billion, and it's a pipeline that stretches across Turkey. It's part of a new program of 250 energy projects across 7 countries, not just Turkey. But you can learn more about these winners and these projects via the PMI website, of course. Well, the IPMA, the International Project Management Association, have also announced the winners of their Project Manager of the Year awards. November seems to be the celebration of project management across different professional bodies. The judges at IPMA have decided to award the Bronze Award to Catalin Borbeni. The judges were impressed by Catalin's focus on people as crucial for project success and the way she managed the project with creativity, vigor, and an open mind to all parties involved. The Silver Award went to Simon Kirkpatrick. The judges were particularly impressed by his strategic development of client relationships in the project that created opportunities for growth and maintained stakeholder engagement with government and regulators, whilst achieving annual cost savings and 98% staff retention rate. However, the highest award, the Gold Award, went to Noor Zulfikar Noor Ibrahim. The judges were impressed by his innovative and exemplary leadership that helped to transform challenges into opportunities in an unprecedented complex project to overcome significant schedule delays and workplace safety issues. So we can see we have leadership, strategic awareness, effective stakeholder management, and people skills. These were the factors contributing to these winnings. Congratulations to winners, and if you want to learn about the project they led, you can visit, of course, the IPMA website. In the same topic about being excellent in what we do as project managers, UK Construction declared climate and biodiversity emergency. Construction Declares is a global petition uniting all strands of construction and the built environment. It's both a public declaration of our planet's environmental crisis and a commitment to take positive action in response to climate breakdown and biodiversity collapse. Originally, this has been initiated by UK Architects Declare, which is a network of architectural practices committed to addressing the climate and biodiversity emergency. Originated by architects Steve Tompkins and Michael Polin and launched on 30th of May 2019, it quickly attracted hundreds of other architectural practices from across the UK. Then, under the wider banner of Construction Declares, it has now spread to more than 20 different countries with over 5,000 signatories and has been adapted by other built environment disciplines that have signed up to variations on the original 11-point declaration. Architects Declare and Construction Declare is about encouragement, with every signatory organization expected to self-govern its progress towards achieving the commitments it had made. On the basis that no single architect is currently meeting every part of the radical commitment to change, a firm no public blame and shame policy is in place. Construction Declares can be used by everyone involved in the built environment sector: architects, designers, engineers, project managers also, students and academics. UK Project Managers Declare followed the initiative, and we have now what we call UK Project Managers Declare Climate and Biodiversity Emergency. They state that they will strive to raise awareness of the climate and biodiversity emergencies and the urgent need for action amongst clients, collaborators, and supply chain across projects, advocate for faster change in industry towards regenerative project practices and a higher governmental funding priority to support this, establish principles to mitigate climate and biodiversity impacts as a key measure of project success. So it's not only the iron triangle that we would be looking at. If we follow this, we will be looking at principles to mitigate climate and biodiversity impact as a factor or as a key measure of success. Share knowledge, research, and experience on an open source basis. Evaluate all new projects against the aspiration to contribute positively to mitigating climate breakdown and encourage clients to adopt this approach across the entire project lifecycle. Upgrade existing assets for extended use as a more carbon-efficient alternative to demolition and replacement when that is the most efficient solution for whole-life carbon. Collaborate with clients, designers, contractors, and other project stakeholders to further reduce waste during construction and operation. And of course, try to minimize wasteful use of resources in projects, both in quantum and in detail. We hope that every organization managing projects or teaching project managers in the UK will join us in making this commitment. If you are interested, of course, as a student, as a practitioner, as an academic, you can follow the hashtag on LinkedIn, hashtag Project Managers Declare or Construction Declare. And additionally, they have a meeting next week. They have a virtual meeting on Tuesday, the 1st of December. It's open to everyone and it's free. Everyone who's working in the built environment can attend that meeting. You can register to attend via Eventbrite. Okay, now money-wise, the Chancellor pledges £100 billion infrastructure spending to kickstart UK economy. Infrastructure is, of course, at the heart of government plans to kickstart the UK economy in 2021, with Chancellor Sunak promising £100 billion of capital expenditure on infrastructure. The Chancellor's autumn spending review has also promised a £4 billion levelling up fund to spend on local infrastructure, a new national infrastructure strategy, and a UK infrastructure bank to be based in the north of England. Beyond this, Sunak has pledged an additional £2 billion for public transport, £3 billion for local authorities, and £250 million to help councils tackle rough sleeping. However, public sector pay has been frozen, unfortunately, in thousands of jobs, and the overseas aid budget is to be cut by around £5 billion. The funding announcements come against a backdrop of bad news about the state of the UK economy, which is expected to contract by 11% this year, while unemployment is expected to reach 7.5% next spring, with 2.6 million people out of work. Making the announcements, Sunak said, today's spending review also delivers stronger public services, paying for new hospitals, better schools and safer streets, and it delivers a once-in-a-generation investment in infrastructure, creating jobs, growing the economy, and increasing pride in the places people call home. So despite the gloomy forecast employment rates, project managers will be in high demand to lead on these infrastructure projects. Now back to what we talk about on a daily basis, COVID-19. UK setting up vaccine centres ready for the rollout of the vaccine. The NHS is setting up vaccination centres across the UK in preparation for any jab being approved, the Health Secretary Matt Hancock has said. People will be vaccinated at sites around the country as well as in hospitals and by GPs in the community. The government has also officially asked the medical regulator to assess the Pfizer and BioNTech vaccine. Mr. Hancock said if the regulator approved it, vaccination could start next month. But the bulk of the vaccination rollout would be in the new year, he added. Speaking at the Downing Street briefing, Mr. Hancock said the NHS is in the process of establishing vaccination centres across the country that can manage the logistical challenge of needing to store the Pfizer-BioNTech vaccine at -70 degrees. In addition, it's establishing vaccination hubs in hospitals for NHS staff. These two routes are likely to comprise the bulk of the campaign this side of the new year. Then there will be a community rollout involving GPs and pharmacists. Vaccination centres could be set up in places like sports halls, and earlier this week it was confirmed that a sports arena in Derby had been earmarked to be used. On the question of when people could get vaccinated, Mr. Hancock said, "I know everyone wants to know about the timing and the speed of the rollout. That will depend on the speed at which the vaccine can be manufactured. We know that the manufacturing process for all vaccines is difficult and uncertain, so I have asked the NHS to be ready to deploy at the speed at which the vaccine can be produced. If, and it still is an if the regulator approves a vaccine, we will be ready to start the vaccination next month, which is December, with the bulk of the rollout in the new year. We are heading in the right direction, but there is still a long way to go. Mr. Hancock also confirmed the government had formally asked the independent medical regulator, the Medicines and Healthcare Product Regulatory Agency, to assess the Pfizer-BioNTech vaccine. He said the UK government had been given the confidence to begin the process after the vaccine makers applied for approval in the US. On the Oxford AstraZeneca vaccine, a total of 3 COVID-19 jabs have been declared safe and effective, but none are declared or are cleared yet for public use. The results of late-stage trials that show the COVID-19 vaccine developed by Oxford University and AstraZeneca is at least 70% effective. This marks a big step forward, but not the last before the jab can be approved by UK health regulators. First, the full data from phase 3 will have to be published in a peer-reviewed journal supplementing the summary announced earlier this week. Medical regulators will want to know exactly how many coronavirus infections and how many serious infections were reported in each trial group, including those given a placebo, in order to calculate each vaccine's efficacy rate for themselves. Dr. June Rain, the Chief Executive of the UK's Medicines and Healthcare Products Regulatory Agency, the MHRA, has said that her organisation will aim to make a decision in the shortest time possible without compromising the thoroughness of the review. However, the process won't end when approval comes, which is likely to be next month, but the MHRA is also involved in pharmacovigilance, which is monitoring the safety of all medicines throughout their marketed life. On this note, it's time to welcome our guest, Matheus, to tell us more about projects in pharmaceuticals and to have an insightful discussion and maybe hopefully help us answer some of the questions that we have. So let us all say hi to Matheus. Hello, how are you?
Hello, Dania. I'm fine, thank you. How about yourself?
Good. How is Switzerland?
It's good. It's good. Today it's a bit foggy. In November here, it's a bit foggy all the days, but it's good. It's getting cold,
It's not
but
just
everything's fine. Yes,
okay.
exactly.
Good. Thank you for joining us today, and we are really excited. Everybody is talking about vaccines. Everybody is talking about medication. It's been our life since the beginning of this year. So why don't we start by you introducing yourself to the audience?
Sure. Yeah. So my name is Matheus Cavicchioli, as you said. So I'm by origin, I'm Brazilian, but also half Italian. I've been here in Europe now for this time 3 years already. I've been here actually, was working for a German company in Brazil, and then I was moving for Germany first, where I did my master degree as well. And then finally, a little bit more than a year, I moved to Switzerland. Yeah, basically, I've been working with project management now, I think, for a little bit more than 10 years. I started working as a project analyst and then became a project manager, and then started to move on my career in this direction. As you said, nowadays I'm working for the last 3 years for pharmaceutical industries or for the health industry. Basically, now I'm working for Tilot's Pharma as a project portfolio manager, but before I was working for Roche, developing medical devices, basically. So focusing also in the COVID thing, but for the building the instruments to proceed with the laboratory analysis to diagnosis of the COVID.
Thank you, and I know that you've progressed very quickly in the position. So you used to work as a project manager, then as a program manager, then as a portfolio manager. So you went through all the P3M roles, which is very exciting. And right now your title is a portfolio manager, right?
Exactly.
Yeah. Okay. It will be interesting to hear the differences between these, but we'll come to this later.
Perfect. Yeah.
Okay, so why don't we start with a few characteristics of the industry? So each industry, each sector, they've got their own characteristics, of course,
Hmm.
and their own
Hmm.
ways of managing projects. How would you characterize the pharmaceutical projects and the
Yeah, I
company?
think. Yeah, I think for this industry, what we have basically it's a really high regulated environment. So I think this makes a lot of difference for everything that we do. So basically, as you were saying in the news, for example, for the vaccine now we have we have the studies, we have like research that was done before. However, it's still always the dependence of the regulators to approve or not the medicines or the medical devices, whatever we talk about. But I think this is one of the main aspects of the industry. So, and this has an impact in almost everything when it comes to project management, because you have, of course, uh, not control of these things. For example, when you submit something for the regulator, you can estimate, but you cannot really have sure if they will back with new questions, or if they will simply approve, or if they will even reject your submission. So basically, I think this is something important, and also all the documentation that you need to have from the start of the project. It's pretty heavy as well. So you really need to document each step, and then you need to have a quality management system in place that really has signatories, reviewers, approvers, and everything like that. So since from the beginning, so this makes the whole project management thing a bit robust, that you need to really have many stakeholders involved, and also to do estimations makes the work a bit more difficult as well.
Yeah. Uh, so my next question is actually about life cycle, and this has to do with estimation and the
Hmm.
approval from regulators, as well as you said. So we hear that usually the development of a vaccine would take up to 10 years in normal conditions,
Yes.
or 3 to 5 years if we are optimistic. How would you shorten something that long? Whether it's a vaccine or it's a medication of some sort, what do you do to shorten it? Is it the production? Is it the design? Is it the approvals that could be made quicker? Made quicker?
Yeah, as you said, normally for developing of a new medicine or a new vaccine, normally it takes from 10 to 15 years. You were completely right. And then for vaccines, I was just doing a small research. So basically, I think that the fastest vaccine that was ever developed was a vaccine that was done in 1967. It took 4 years to be developed. So, but I think to understand a bit more like of the complexity, we can quickly talk about the steps. So basically, you start with a basic research that you are trying to understand what can be done, what are the molecules and everything that should be studied. Then you have a drug discovery, so you know what you found what you were looking for, and then you start to work in this development to make it like stable enough and things like that, and then you go for a preclinical analysis. So basically, this is the pre work that it's done, and then normally there you already spend 4 to 6 years. Then you start basically when you see, okay, this makes sense, and then we can try to see if it's effective enough. Then you start the clinical trials. So the clinical trials, everybody's talking about these now. We have many vaccines in phase 3 and so on. So basically you have these 3 phases, and then what differs then it's basically the number of volunteers that you have. So phase 1 you have tens, phase 2 you have the hundreds, and then the phase 3 you have thousands of people, and then you finally submit this for the regulator to approve it or not. So this is why I believe it's taking too long. And then you have prerequisites in between that makes the difference in the process. For example, if you are in the clinical trial, and then if you have any unexpected reaction, you need to stop You need to analyze, you need to investigate, and then you need to see what was the reasons, for example. Uh, as the case of COVID now, if you are developing a vaccine, you need to have, like, in the amount of the people, a number of infected people, also to see and calculate the effectiveness of your vaccine or your medicine. So it's a very complex setup. What I believe that now really made the difference that we could achieve this record. And of course, we have better technology, we have people really engaged, but I think the collaboration between the community, the scientists, and the companies and the industry was making completely difference, because I think now it's everybody working together to have this as a priority. So I think this basically could bring this as fast as we are now with this research. So I really think that even the regulators now are working together with the industries to make it as fast as possible. So it's higher priority and focus on only this. I think this is helping a lot to make it as fast as it is.
I see. And so we can say that the collaboration among governments as well, governments and companies and regulators,
Exactly.
is accelerating this. You mentioned stakeholders, and stakeholder management or stakeholder engagement is a big part of project management.
Mm-hmm.
And it's even one of the success factors, critical success factors for any project, according to research. So since you are, as a company, as a pharma company producing or researching, how do you manage stakeholders? Do you have a specific technique that you apply? Since these people, the approvals, approval is actually the main milestone. It's the gate. If they approve, that's fine. If they don't, then the schedule is, you need to re-estimate everything. So is there a specific way that you deal with stakeholders?
Yeah, I think especially for external stakeholders as regulatory bodies and so on, I think have a good relationship for them. It's for sure one thing that you should try always to achieve, and then also to keep them informed of your whole process. So what normally you see many companies doing doing this collaboration with regulators even in early stages. So they are always informing what they are doing, what stage they are, if they have any concerns and stuff like that. So really to get as maximum information and also to provide information and receive information from the regulators before you submit your dossier formally. So basically try to manage these expectations for the stakeholders. In this sense, it's really a success factor for the project.
So you do it beforehand. You include it in your planning that you have to have this discussion and conversation with them before you even submit to them.
Exactly, because might be that that they have a preview analysis and then they say, hey, I didn't understand this this data here, so why you put this and not that. So then you can already previously try to address these comments before you really start to submit officially. In some cases it's not possible, like for example now I would say that all regulators around the world are really trying to find a solution for COVID. So if you try to do it for any other medicine, I don't know how good this would work because of the focus that they are having, and then this makes completely sense. But yeah, I think it's a opportunity always to try to reach them before and try to manage if you are going the right direction.
Would you say, it just crossed my mind, because everybody is highly motivated and they are highly pushed from, as we said, countries, governments, and big companies,
Sure.
regulators, because it's a crisis, isn't it? So I've just thought that maybe sometimes crisis management makes stakeholder management easier, as opposed to normal project management. It's a crisis and everybody's together, everybody is collaborating without even you needing to motivate them or push them. So it's interesting to see all this collaboration.
Yeah, this is why I would say that the word, if I could summarize, it's the collaboration between everybody. Because, as you said, the motivation it's so high, and for many aspects. So you have governments that they have not only economic impacts but also health impacts, and all of this surrounds making people really collaborating, and looking for this collaboration without any incentive or anything. I think this is a very important point there.
Let's talk about agile and waterfall. You've said that you've mentioned the steps, the phases. We can call them the life cycle, which goes from design, research, design, and then the application for approval, and then the production.
Mhm.
What kind of methodology do you use? And is agile one of the things that, since there's a design, trial and error, would you be using agile, or do you use the waterfall one?
Yeah, to be honest, you can find very few things in agile for pharmaceutical companies or for healthy companies. You see, there is the big companies. They are trying to adapt, and then to become more agile. Uh, in the other hand, the smaller companies, they are still really traditional. They are really going for the waterfall, trying to have this as more in a more traditional way, in the more conservative way as well. But you can see both. The thing is, for example, these things that we were talking before about the stakeholder management. So you bring this kind of information beforehand for regulators that they can analyze and give you feedback. In theory, it could be seen as an agile approach already, right? So that you are trying to manage the expectations from your customer, or for an important stakeholder, and then it's giving the feedback loops. So in theory, this could be seen already as an agile approach. But as I said, it's as the whole industry, it's really high regulated. Uh, it it brings the whole agile topic a bit more to difficult to do in order to really break these steps. So basically, we try to stay more in a more waterfallish way. But yeah, there's companies, especially for software development in pharmaceutical, for medical devices, for example, that they are already applying agile methodologies, and is still being following the regulations. So it's possible.
Yeah. Okay. Thank you for this. Everybody is going agile now. It's
Yes.
being promoted everywhere, and it's proved successful. Whenever you need, as you said, whenever you need close attention to customer expectations, and it looks like your customer is the regulators. This is the first, the direct customer, right? And then later you have the users, which is the normal population. Let me ask you something about project constraints. The job of any project manager or program manager is to deliver within time, within budget, and to quality, right? Which is the iron triangle. Quality seems to be of top priority, obviously, for any medication or even an equipment, even a ventilator, right? And we remember the case with Dyson, when the ventilators got rejected because they were not up. They did not map to the standards in the UK. So it's very important. The quality is of top priority. How do you deal with the constraints of time, quality, and cost when you have something like COVID-19 vaccine? Because time is of an essence. You don't have all the time in the world. You don't have 10 years. You don't have even 5. You don't have even 1 year. It's less than 1 year. So is there any compromise, you think, from your own experience or personal view? Do you think there are any compromise when you look at cost, quality, and time in terms of the delivery of a vaccine?
Yeah, I think, as you said, it's. I always put, like, in this triangle, I always put the quality in the center, and I play with the scope, time, and costs. So in this case, basically, you cannot, as you said, you cannot reduce quality. You don't have time, and then what you are really seeing now, it's a lot of money that are being injected in this whole process. So you see, the governments are really beforehand even paying for the vaccines, that are in the developing stage. So you see the companies investing a lot on this as well. So it is how it is, yeah. So you cannot change the time. You are running against the time. You cannot like reduce quality because it's not possible or it won't be approved, and also not being effective. So the only one who remains is the money. So then you put like all your efforts on there, and then you are trying to make it regardless the price, basically, right? So you are investing all your resources, human resources and material and machinery and everything in order to make it possible. So I think this is a compromise that it's basically everybody seeing, and that the money it's flowing in that sense.
But this also will mean a compromise on. We know we could add budget, and we know cost will be compromised, but that means later the price will be higher. And we've seen this with the Pfizer and BioNTech vaccine, which is much more expensive, isn't it? So later on, even if you compromise on the cost during the production phase and the development phase, later on, this vaccine will be more expensive. I mean, as compared to,
Yep.
So it will be reflected in the price eventually. And I think we were having a discussion with the students yesterday, and the case study was the Oxford AstraZeneca project, the vaccine development compared with Pfizer and Moderna vaccines. And we know that storing the Pfizer and BioNTech vaccine requires very strict conditions under the minus 70 degrees.
Exactly.
Which could be part of the quality. I would say that would you agree with me that these people compromised on the quality, or not just the quality, maybe the scope or some technical specifications to make it more quicker, but this affected the price later?
Yeah, I would relate this to the scope actually. I wouldn't doubt of the quality aspect, but when it comes to the scope, and then you have acceptance criteria, for example, I don't believe that transportation temperature was not taken in consideration for the definition of this criteria, this acceptance criteria for this part of the project. So. Yeah, and then I believe you have not many options. That's exactly the point. So you should then at some point do a choice. So I do have a vaccine and need to transport and keep it in a minus 70 degrees Celsius, or I don't have at all. So then I think it's of course it's impacting, and then in the longer run, I think this could make difference. So in the long run, where we have, I don't know, like in the next 2 years or so, when it might be that we still have this vaccine going on, and people need to have it, then for sure they will go for the easiest to be transported or for the cheaper version, and so on. So, but I think for the moment they are just playing with the cards that they have. So I think it's making it.
Scope, you would say.
Exactly.
Yeah.
Exactly.
Yeah. To finish on time with the efficacy required, with the efficiency required.
Exactly.
You said something about estimation, Matthias, in the beginning, and estimation is, the card that the play manager plays with all the time. If you set up a reasonable time scale and you finish within that time scale, you are successful. If you underestimate the time and the cost needed, then you will look like a failure at the end, although it was a bad estimation at the beginning. In pharmaceuticals, you're a project manager and you have a team. Who does estimation? Is it you, the team, or someone else?
No, it's not the project manager or any project leader who normally does the estimation. So normally in this, and then I think it's a particularity of this industry as well. We have normally SMEs, so this subject matter experts, and then they are split for all the areas that involves like the development or the project. So we have from R&D people, and we have like regulatory people, we have quality specialists, we have production and operations specialists, and so on. So these people are basically the responsible to give the estimations for the project normally. What the project manager does basically is to put these things together, plan buffers if he judges if it's necessary, and then of course challenge if he has a bit of the knowledge, or if he has historical data that he can compare this project to another, and then he can of course study this data and try to challenge the SMEs in the sense of if it could be shortened, or if it could be using less resources, or whatever he believes. But basically the estimation is coming from the team, from the specialists in each area, which I believe also increases a lot the commitment to the people towards the project schedule. So, because it's something that if you give a task to someone that you have estimated and they need to fulfill that time, another thing it's if they have done this estimation, they need to fulfill that date. So I think you increase commitment as well when the specialists are doing their own estimations.
As a project or program manager, have you ever challenged any of the estimation of these experts?
Many times. Yeah, I think that's the thing when you are working a bit longer with this kind of projects, or when you have enough data that you can collect around, then I think it's always the case. If you have a similar project, for example, to do a verification and validation plan, uh, they estimated 6 months, but you had like this done before in 3 months. If you check like if there was same complexity or same number of resources, then you can to challenge and say, hey, I have to look at this. Why at that time we could do in 3 months and now it's 6? Sometimes they really have reasons behind it, to say, yeah, that's true because of this and that, or whatever reason they had. But sometimes it's just that I think it's the nature of human being as well, to try to put some buffer and try to have some not time pressure there, and then we always need to have a look better in each estimation.
So is it, you said these are experts, but these are internal experts. They are
Yes.
employed by the company.
Yes.
If this happens frequently, and there was this frequent challenging of their estimates, would you say there is a gap, or do they depend on different factors when estimating than the factors that you consider? Do they look at it from a purely technical point of view, whereas you look at it from a managerial, resources, and complexity point of view?
Exactly. I think this is as I see the main function of the project manager in this kind of projects. I see the project manager as first of all as a glue for all of these areas. So they put the information together and bring them together. But also I see that many times like they see just like with their view, so they don't have sometimes the global view, or what like that specific task is impacting other tasks, and the dependence that it has. So basically I think this challenging, it's can be very healthy if you do it in a proper way, just to because sometimes people are not considering that they could have another device for doing testing, for example. They just have one device, and then they say, yeah, with one device I need 3 months, but say, yeah, what if you have two? What then? And then you can really bring this kind of options, if you have them, to try to help them to reduce or even to optimize timelines. Sometimes it's not only for reducing, but to better use the resources you have. And I think it's always worth to challenge and to discuss the options that might be available.
What about change control procedures? And because it's highly regulated, we know
Mhm.
that change. Any stories come to mind about change that you have to go through, and then even not a vaccine, any other medical product?
Yeah. I think it's funny because I've been working before, back to the pharmaceutical area. I've been working with automation and a bit of construction. So it was basically the construction of automated warehouses. And then I was back in Brazil, so working with the engineering here in Europe. and then we were receiving like containers of material, steelworks and electronic material, mechanical material in Brazil. And then sometimes you were there in the site, and then you say, "Whoopsie, there is an architect that forgot to draw a column here that we need to pass through. So what can we do?" And then if you had the material, you just like do the chains on site, and then you do a as-built drawing and everything else that is related to the documentation, quickie and simple. That was done. Uh, and then now working with medical devices, it's completely the opposite. So if you have like one screw that you need to change in a specific medical device, sometimes you need to do the whole procedure of verification and validation of the product because one simple change. So it and then it can be really simple things. If you have like obsolescence, for example, of a motor, you just need to change, you need to do all the verification and tests again. So then and then not only the test itself practically, but also all the documentation related. Sometimes you even need to submit for approval as well, and all of this. So it's kind of it's not really dynamic, let's put it like this, as it is in other industries.
Yeah, and how do you deal with these risks of change? If you need to do any change, and if there is no approval, for example, how do you reflect this on your schedule?
Yeah, actually, it's a trick thing to do, right? I mean, when you are having a completely new development, so normally you don't have this kind of problems because you are trying to map all these things during the development process. That when you submit final versions. So that then you don't need to go back after a year or so and do a change. So this is how we try to mitigate these problems. However, when you are trying to, or when you are working with a project which is already in the market, and for any reason there is like obsolescence that you need to change because the manufacturer will stop to produce, for example, a part, then you have no other way. You need to go through this process. So and then this is reflected as best as you can estimate this kind of things. So we really try to work together with sourcing, with production planning, and try to map if you have any foreseen of things that will be out of market and stuff like that. So that it's the I believe this is the best way to do the mitigation of this. But sometimes you have surprises.
So, how many out of the projects that you led, how many finished on time within budget and the scope?
very, very few. No, I think yeah, I don't know a percentage, but if when I look back for the last few years, I would say within the three aspects in fulfilling the scope, the time and the costs, it's very few, like maybe 10% or so. But yeah, I think it's kind of something that we have in project management, especially in this dynamic environment that we live with many changes and many constraints. But what I think we should take in consideration, it's look back and really see, and this is why I think for project management, or from the project management perspective, to have all documented and to have the things really written down and stuff like that. Because normally, also if you do the same question, oh, how many projects you had in the past that was keeping the same baseline from the day one, I would say none of them.
None.
So this is why I think it's hard to keep within budget and schedule and keeping the scope. So basically, the things are changing, and then I think have these changes under control. It's important because then you have new baselines. Let's put it like this.
Yeah, and that's maybe my next question regarding lessons learned. If you would like to give advice to anybody who's going to be a project manager, a scheduler on a medical device project or a vaccine development project, what kind of advice you would give them if they want to plan time, for example, the timeline?
Yeah, what normally I always say, and then I still see in the industry or in the industries that I've been working is especially when the project manager has the knowledge of the business in the industry that they are, normally they try to do the things by themselves, right? So that if you are a civil engineer and then you have a construction a project, you can see them and say, okay, this will do take 2 months and I know it, and that's it. I really think that the lessons learned that I had in these years working with project management is, as much as you involve the team, as much chances to have success you have. So really, even though if you know how long it would take, I would suggest you to go to the specialists or to the people who will perform the task and bring them and ask them how long it would take. And then if they have something different than what you have, then yes, so then you can challenge, then you can discuss, then you can understand why he's saying something different than what you thought. So then you can be convinced or not, but I think it's important to have the people commitment and to have people engaged to be in the project team and to be motivated to achieve their tasks.
Okay. My question about your job as a portfolio program and project manager, you know the functions of managing a project. You have stakeholder management, communication management, quality management, change management, risk management. Out of these, which one you would say is the most challenging out of the functions of project management?
Yeah, I think there's several changes I believe in this when you look for the whole thing. Yeah, I think risk is a tricky one because I think risk management. Uh, what I have seen is or people do like huge project management lists and risks, but they never go back to it. So it doesn't help much. So I would rather prefer to have like 10 risks, important risks, and that we go monthly and see if the mitigation is working, if we have responses, if the strategy is right or not, than to have like a huge 150 list items and never look to them. So I think risk management is tricky, but also I believe that if you at the beginning of the project, if you don't do like a proper scope management, you have many risks to put like things that should be out of scope inside your scope, and then you can get in trouble to still fulfill time and uh, uh, and costs. So I think it's scope management. It's one that I would always keep my attention especially in the beginning of the project.
Excellent. I think we will open it up to the audience for some Q&As, and I've just received on the this is actually sent on the private chat. I've just received a question. It's an interesting one about pharmaceuticals and in general. People think about the pharmaceutical industry as very wealthy. They've got lots of money, and there's always this conspiracy around pharmaceuticals that they invent the disease and then they so can, create the cure. Of course, we're not going to discuss this, but what could you say about the industry as a whole, since you've worked for the industry for 10 years? The question is to lift this stigma on why do people have this impression? Why do people keep thinking about the pharmaceutical like this? And that's the actual question.
Yeah, I think it's when you are working for this industry, basically, it's not something that's even discussed inside the industry. So, because when you are there, you really see that people are really working to develop new things and so on. But when you look to the numbers a bit of the pharma industry, it's a bit like interesting. Yeah? So basically only 6% of all the initial development things are even going for a clinical trial, basically. So only 6%. It's almost nothing. So there is a lot. It's a lot of research done basically nothing, because at the very end they will not become a medicine. But I would say it's a right assumption that the company is a wealth company, wealthy industry, and then it's true. I mean, I've been working for the automotive industry, for example, and then there they are really, really, like, it's unbelievable, because the competition is so high, and the market is so close that it's every single cent counts.
Mm.
And in the pharmaceutical industry, yes, they have more money, and then this brings a bit more of flexibility, or even window for errors. But I think this is changing as well in the last few years. You see that they are getting more and more cost pressure around it, and then they need to answer and be more effective and efficient as well. So this is something like that's clear, I think, from the industries. For example, if you go to again automotive, you have lean manufacturing, you have everything to bring this to the highest level of efficiency. And then, but I think all industries are a bit learning from these and trying to be more efficient and be more profitable at the very end.
On that note, we have a question from Nadia that says, all industries are trying to learn. How easy in this case, if we assume there is learning or there isn't among industries, how easy is the transition from project management in other disciplines to pharma? If you want, and you did that, that. How easy?
Yeah, I think this is just to bring another delicate topic to the discussion. Then, I remember when I was doing my master, I think one of the first classes I had was about some beliefs in project management, and then I think that at that time we need to write a essay saying from which side were we, in the sense of, are you believing that project managers need to be specific knowledge for that project that he's managing, or no, do you think the project manager, as far as he's a project manager by education and so on, he can manage a project, meaning a more generalist approach? So by answering this question, I really believe in the second option, and then I even wrote regarding this. I really believe that the project management is a discipline by itself. Mm-hmm. So then I believe that it's completely fine to do these transitions. As you said, I did this couple of times. So I worked for automotive company, and then I changed for chemical companies, and then I went back to automation and outsourcing, and then now in pharma. So I really think when you have a strong set of skills and a toolbox in project management, that you can really go through all the process and make it in an optimal way, that you can navigate between industries and disciplines. I really trust that. As I said, I see a project manager as a glue for all these areas and disciplines that are part of the project. So this is why I really believe that the project management by itself, it's a discipline. And then, of course, when you have more knowledge in what you are doing, you can challenge best, you can have a better understanding. But I really believe that if you follow processes, if you do like a project charter, if you have a scope statement in place, and working with the team of specialists, you can manage any type of project.
Perfect. This is very encouraging to our students who are studying MSc in project management in general, not specialized in industry. And this is also my question and Nadia's question. What career advice can you give to our students who are completing their MSc in project management?
Yeah, I think it's as I said, I think it's really open area, and then I really like project management because of these opportunities that you have to go for any industry or any kind of project. So I think if I could give an advice, it's not be attached to what you have studied, basically. So when I look to myself, as I said, I'm a technician in mechanics. Then I did an industrial engineering bachelor, and then finally I did my master degree in international project management. But I've been working with like many kind of things, automotive industries, pharmaceutical. Inside pharmaceutical, I work with like IT development, for example, and then also now with back to portfolio management. So don't restrict yourself to any kind of label or don't take just because of your education that you cannot do other things. I think it's a pretty open market, and they are really accepting like people who has experience in project management.
Thank you very much, Matthias. And thank you for answering all these questions. We went a little bit into details about the technicality of managing projects.
Mm-hmm.
And thank you to questions from the audience. I hope that you enjoyed this. We enjoyed it. And I look forward to any collaboration in the future as well. And thank you for being with us today.
Thank you.
Final comment, final words?
Thank you. Yeah, just thank you for having me. It was a pleasure. As you said, thank you all for the questions as well. And yeah, so let's be in touch, and if I can help or share something, and then we can keep collaborating, would be great.
Thank you. Thank you very much, Matthias.
Thank you. Ciao. Bye bye.
So to our audience, thanks for listening, and we would like to announce that we will not be having any episodes in December. The last Thursday of December is the holidays anyway, so we hope that you have a healthy and safe Christmas. Our next episode is going to be in January, the 28th of January, and with more topics, of course, for the new year, more exciting topics and more pressing topics, and of course with very interesting and very delightful and influential, knowledgeable guests, as always. So I would like to thank you for being with us today, and we wish you the very best for the new year. We hope that it's going to be a more pleasant year than the one that we just had. So thank you very much, and goodbye.